If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 17th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussion. Now, for those who are new to the show, there are two ways to get your questions in. First, call the live phone line at 718-499-6101. Second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. Now, we got a great panel tonight here. For this episode, I have Dr. Sabia Friedrich,
yes,
right? Very nice. Internal medicine attending at New York Methodist Hospital, and Dr. Igor Mamkin, cardiology attending at New York Methodist Hospital. Welcome to both of you, and I'm really excited to have you. I see Dr. Mamkin brought in some show and tell, which we're going to get into, and beautiful outfit that Dr. Fishkin is wearing, Friedrichsen. And of course, our on-air assistant, Kirsten Elizabeth, over there, smiling as always, brings cheer to the show. And this has been a really tough week. We need cheer with toughs that our families and friends and neighbors have gone through, what Sandy wreaked havoc on our lives and killed many innocent people. Our prayers and goodwill are out for those, especially our loyal viewers. And let us help each other in small ways or big ways. Let's have a minute of silence for those who perished in this tragedy. So how did you make out, Kirsten?
Well, you know, we were really lucky. I live in Astoria, and we had power and everything, but some of our friends weren't so lucky. They lived out in Breezy Point, so we've been trying to...
What a tragedy. I mean, starts with flooding, and then fire burns 100 homes, at least 100 homes, I know.
It's really rough out there right now.
Yeah. So not a happy time, not a great time, but we're moving on, and we have an election today, and I was amazed.
I voted.
The lines, did you see these lines?
Yes.
I mean, around the corner, it's amazing. And the gas lines around the corner. So we have a very unusual time in our history. But we have asked the doctor to bring us here to continue, maybe get a few laughs and learn something about our health. So let me remind you now, before we go further, that the number to call, and we have some open lines now, is 718-499-6101. Our topics are cardiology, that's the heart, and internal medicine, that's all of the body. Or you can email us your questions to askthedoctor@netny.net. And I think, should we go into In the News?
I think we should.
Okay, In the News. Yeah, no, this is, you get only the best when you come here. This is not Fox. Okay. Now, we have a few key stories. It was kind of a slow week with all the presidential elections, but for melanomas, okay, it's always been assumed that redheads, people who are fair-skinned, have increased risk of melanomas because their skin doesn't have the same protective mechanisms as others. You know, it turns out that's not true. It turns out that there's a gene for melanoma, and those who are fair-skinned or redheaded genes pick it up. And this gene actually predisposes to cancer without sunning. So you're picking up this melanoma. You think you're protecting yourself 100% by avoiding the sun, which you should be doing. But the key here is that's not enough. You know, you have to be on the lookout if you're fair, redheaded, like myself, right? So I got to get into the doctor and let him look for melanoma. Okay, also a new drug for multiple sclerosis. Now, I don't know who the marketing person is for this pharmacy, but the name of the drug is alemtuzumab. Who's going to remember that? Can you imagine trying to say, I want this alemtuzumab or whatever this is? So I put it up on the screen. I hope that Teresia put it up there so you know what it is, because it's a major breakthrough in multiple sclerosis. You know, multiple sclerosis is an autoimmune disease where the body attacks its own nerves and other parts of the body. And it relapses. You're better, and then it gets worse. This cuts down on the relapses significantly by over 50% compared to what our standard medication is. So it's something you want to ask your doctors about, and particularly if you know someone with multiple sclerosis, because this is a big advance. It will probably be ready within a couple of months. It's already finished all the testing trials and so on. So we're looking forward to that. Now another one, maybe not the most appetizing for those eating supper, the head lice. Did you ever deal with that?
Not me.
No, you see, now that's the one advantage to that look. But you know, these little critters that are in there, and you're going through with combs to try and pick them out. It's disgusting. There's a new medication. In other words, not the best, ivermectin. Ivermectin. You heard of that?
Yes.
Very good. Very good. So you go in, and it's supposed to be a last resort. They're not advocating using it as a first treatment. There's a drug, Permethrin, which is a first treatment. But this would be a backup. So something to keep in mind with schools starting again and so on. Have you ever seen these head lice?
Yes, I have actually.
How?
I saw it in school.
And the other kids?
Yes.
And then your mother had to go through your hair and stuff?
With fine combing.
Yeah, that's it.
Yeah.
It's not one of the more pleasant.
No.
And then finally, to complete the news of this week, the energy drink, Monster Energy drink. There have been some deaths and severe problems associated with this. You have an idea, like if you have a can of soda has a certain amount of caffeine, how much caffeine is in one of these Monster Energy drinks? How many cans of soda?
My guess is each can has maybe 500 to 700 calories.
Yeah. But in the caffeine world,
Caffeine.
you have to drink 7 cans of soda to equal the caffeine in one of these.
Wow.
So you drink one of these, you're getting 7 cans of soda worth of caffeine. You take a young person who doesn't have a lot of body weight, that person's going to have a problem possibly. And
Absolutely.
one had a heart attack, and the others were admitted with irregular heartbeat. So I don't know, we haven't seen it, there's not that many, but it's something to think about before you let your kids go out. Not to mention the sugar that's enclosed in these drinks. So that's in the news. It was kind of some interesting stories. You learn a little bit. You come here, right? Okay. Okay. Kirsten, what's going on with the quiz? Is there any quiz this week?
We do have a quiz this
Okay.
week. Okay, is everyone paying attention? All right, here are the questions. So last Tuesday, as you know, Ask the Doctor was preempted by one of the worst hurricanes in our history, Hurricane Sandy. Now, horrific hurricanes have,
Can you say that 3 times?
Sorry?
Horrific hurricane? I mean, that's a tough one. Yeah.
Horrific hurricanes, exactly, have their names retired. In 2005, 5 hurricane names were retired, the most on record for any year. Now, are you ready for the question? Can you name 2 of the 5 hurricane names retired that year? So can you name 2 of the 5 hurricane names that were retired in 2005? Now, the second quiz question. The United States Conference of Catholic Bishops assigned American saints, blesseds, and venerables for each month during this year of faith. We are encouraged to study their lives and follow their examples. Now the question, can you tell us who did the USCCB assign for this month, November 2012, and for November 2013?
Kirsten, you come up with riveting questions these days.
I'm so smart.
This is great. Great question. So we got a lot to do. We still got a lot of bookkeeping, and we're going to get a little bit more into some shout-outs that we have to do. But let's take a short break now, okay? And when we come back, we're going to be answering questions and meeting the doctors. Our phone number is 718-499-6101. And our topics are cardiology, there's the heart, internal medicine, and we'll be right back. Welcome back to Ask the Doctor. I mean, I can't believe those pictures, the devastation, and not to mention the human life that was lost in these things. I know the couple in Ditmas Park, a 23 and a 24-year-old walking to a shelter to help out. A tree came down, instantly killed both of them. And horrendous stories. Mother's 2 tots swept away. The mother's trying to hold. I just can't even believe it. Anyway, Monsignor, this was a tough week, wasn't it? I see Monsignor Bennett's been out every show. Never misses a show, Monsignor. Good to see you out there. Kirsten, any shout out to our loyal viewers?
Well, as a matter of fact, Dr. Garner, yes, I do have some shout outs. Oh. I have a shout out to Vita Farwana. Hi, Vita. Barbara Modest and Dee from the jewelry area at Saks Fifth Avenue. Thanks for watching, guys. You are the best.
You never can tell when you need to know, jewelry experts at Saks Fifth Avenue.
Absolutely.
Yeah, it's great. And thank you, Kirsten, and thank you all for being such loyal listeners. I had the opportunity to meet with Bishop Caggiano at a dinner, the Francesco Locasano Foundation, which is a group that's gotten together. The parents lost a young teenager of cancer, and they formed a foundation to raise money to help other kids with cancer, to give money to help whatever, for miscellaneous causes as well as their treatment. And Bishop Caggiano, as well as my brother, Dr. Bruce Garner, was honored a couple of Friday nights at Gargiulo's. Amazingly, the next day, 2 days later with the hurricane, it was destroyed, Gargiulo's, by the hurricane. But it was, I know Bishop Caggiano likes the show, so I say hello, Bishop. And the Locasanos, I'm going to talk a little bit later because it was one of the most amazing dinners that I've seen. And the mother of Frankie and the mother's mother are big fans of the show, so we'll talk to them a little bit later, mention what some of the great things they've done. Tonight's topics are cardiology and internal medicine. The number to call is 499-6101. You can also email us your questions at askthodoctor@netny.net. Now, I feel like I've done a whole show. I'm exhausted, but let's try and meet the doctors. Welcome aboard. How are you doing?
Thank you. I'm feeling great. I'm very excited to be here. Thank you for inviting me.
I don't know how you're looking so good when you had a week like you had. Tell the audience a little bit about what happened to you.
Well, I've been much luckier than the pictures we saw here. I was actually in the financial district where the power went off, and we did have some flooding in the seaport area.
What were you doing when the power went off? Do you remember?
I was by my window watching watching the storm, and the whole building was creaking, so I was inching my way towards the hallway where it would be safer.
Was your husband there to help?
No, I was alone.
Uh-oh. Where was he out? Gallivant? What's going on there?
He was at a conference at Harvard, so he was excused, and I was alone in the dark. But I figured, the power will come right back up. It was preemptively turned off, and we will just sleep it off, and next morning will be just another morning. No one, I think, expected this to go on for almost a week with as much devastation as it has caused. But it has been nothing compared to the areas of Long Island, Hoboken, Coney Island. We've been very lucky.
And you're able to take a shower now and do
cold
everything?
Showers.
Cold
but
showers.
It's good for your skin.
It makes it quick.
Yes.
Yeah, very good. So it's great to have you here. I wanted to get you on for a long time, and now we finally have you. So I see the audience lighting up with questions. So thank you very much.
Great. Thank you for having me.
Dr. Mamkin, you also were affected by the hurricane.
I think I was actually a little bit luckier than everybody else. Me and my wife, we decided to go on a short 3-day trip to Mexico. And our 3-day getaway ended up being a 10-day getaway because we could not get a plane back.
All right, that's tough. We feel for you.
It's tough.
I feel like
it's tough.
Very but I understand.
And we were also lucky. We had no damage to the house, no damage to the cars, and everything. We never lost our power, so that's always a good thing. And now we actually have lots of relatives visiting in our house because they live in Jersey. And
that always causes frayed tempers.
No, it's great. The more, the better.
Very good. So we have there's the setting now. We have our 2 doctors identified, and we have our phone calls going. So Kirsten, do we have any action here?
We do have some action. Currently on line 1, we have Patrick, who we know, and he's from Park Slope.
Let's see what Patrick's up to. Hey, Patrick, how you doing?
How you doing, Dr. Garner?
Good. We didn't do out too badly. We just had a couple of trees, trimmed, but nothing compared to what other people had.
Yeah, Dr. Garner, I was down in Staten Island and Midland Beach yesterday. It looks like a war zone. It's terrible. It's terrible.
Were they getting any help? Did you see any supplies getting through?
Plenty of supplies, yeah. There's plenty of supplies, but everybody, it's really terrible.
Yeah,
And,
it is.
Very, very, very sad.
Yeah.
Dr. Garner, I just wanted to ask you, my goddaughter, she's 2 years old. She had contracted RSV as a child.
Okay.
Now, she went to preschool.
That's a virus that kids get, very young virus, respiratory syncytial virus. They have a vaccine for it now, right?
Oh, okay.
But anyway, let's hear.
So what happened was she's been getting sick on and off. So she went to daycare and she come back and she had a very bad cough. So we brought her to the hospital in Montefiore, and they told her it's asthma. So we went. They gave her the machine. We gave her the machine. So about 3 days later, she was really, really bad. She was throwing up and everything. So we brought her to the Methodist, and they took an X-ray, and they said she had slight pneumonia. All right. So she took the medicine, and about a week later, it was the same situation. Took her back to Montefiore, and they said it was asthma again. So, what would you suggest?
Yeah, I mean, a lot of times this RSV can be confused with asthma, can mimic asthma. In general, babies can have these lingering infections or inflammation. Doctor, you want to just address that?
Children can have RSV can lead to bronchiolitis, and they can have inflammation of their small airway diseases, and that can often, on an X-ray, can sometimes look like a pneumonia. And these can linger on and on, especially if she's exposed to cold and virus again. But I believe the treatment is just supportive treatment, keeping her hydrated, just basically waiting it out.
Patrick, if this continues, you're seeing a pediatrician there. The pediatrician may send you to a pediatric pulmonary doctor, specialist in this, just to at least have one checkup, just to make sure that we're on the right track, because as the doctor said, this can have repeated episodes, but it requires just treatment that's supportive, no antibiotics or anything like that.
Right.
So I would ask the pediatrician if it would to be referred to a pediatric pulmonologist, just to get a one-time look over.
Okay, Dr. Garner, thank you very much, and God bless you all.
Okay, be well, Patrick.
You too.
What were you going to say?
Oh, and to continue the nebulizer treatment.
Okay, Patrick's a loyal listener to the show, been with us many years.
Nice.
Do we have any callers?
We do. We have Mary online too. She's from Staten Island.
Oh. Mary, how are you?
Oh. Hi.
Hi, Mary.
No, not doing so good.
No.
We're living in Staten Island.
Mary, I want you to take a step back because I'm getting a lot of feedback. I can't hear exactly what disease you have. So please repeat the disease.
I have diverticulosis.
Okay.
Diverticulitis, they say.
Okay.
I have Graves' disease.
Okay.
I have diabetes.
Well, you're like a walking textbook here. What's going on?
That's right. And I have a mesh.
Okay.
I'm telling you. And
Okay.
I have a mesh from 5 hernias.
Mary, what's your question?
The question is, what do I do? I went to so many.
Okay, Mary, I want you to listen because we have a bad connection, but we're going to answer it. So you listen to the TV and we're going to talk about it. Okay, so let's start down the list. We can work back and forth. You want to talk about Graves' disease?
So Graves' disease is basically an autoimmune disease of the thyroid, and I'm not sure at what stage of her Graves' disease she's at. And
you might be hyper.
You might be hyper. You're mostly hyper. You can at times be hypothyroid, and that could contribute to constipation and maybe contribute to her diverticulosis and diverticulitis. She also has a hiatal hernia that she has a mesh on. I mean, I would encourage her to have a diet rich in fiber, hydrate herself well, maybe manage the constipation better so that she doesn't have as many episodes of this diverticulitis, and of course see a endocrinologist, a hormone specialist for her thyroid disease, for Graves' disease.
Dr. Mamkin, with Graves' disease, what might she exhibit as far as heart disease?
Well, Graves' disease, as you mentioned, causes hyperactivity. So quite often people with Graves' disease may have palpitations, and this is primarily due to various arrhythmias that Graves' disease may cause. And these include atrial fibrillation, atrial flutter, and so forth. And these arrhythmias may potentially be very bad, I mean life-threatening, and may cause many medical problems such as acute diseases such as stroke. So this certainly needs to be addressed in a timely fashion.
So as far as medication, is treatable disease, Graves' disease for heart?
Once again, if we do have arrhythmia, first we need to diagnose the kind of arrhythmia this is, and we can certainly tailor certain medications to treat the arrhythmia. But yes, the arrhythmias associated with Graves' disease are treatable.
And the GI, the stomach problems are also treatable.
The best way to approach it is to make, control your constipation, take a fiber-rich diet, keep yourself hydrated, maybe take stool softeners and such to reduce the number of diverticulitis episodes you have. Other than that, you should get a colonoscopy at some point. I'm not sure what your age you're at, but you may need to see a GI specialist for a colonoscopy and find out why you're having these problems of diverticulitis.
Mary, thank you very much, and I hope that that helps you. Kirsten, how are we moving with the phones tonight?
We're good. You know, we have an old friend on line one.
Could it be
Joe
Stiles?
Stiles. You knew it.
You see, we have like an ESP. You were saying, well, maybe we're not going to get that many calls on election night, but Joe is on one?
Yep.
Joe, how you doing?
Not bad, but not bad. I'm going to talk to the doctor now about my thyroid, and I want to tell him what a great image he makes on his program. And that thing I like tonight, they're leaving the phone number on all the time, which is a great thing they're doing.
Just to refresh the audience, what's the problem?
My problem with the thyroid is that 3 years ago they were going to operate on me, and after seeing 5 doctors, I found a doctor and they put me on a medicine. I want to know what he thinks of it. Synthroid.
Okay, so Joe has he doesn't have a hyperactive. He's got low thyroid.
I'm doing pretty good. I never went for after all that, I never went for an operation.
Okay, so let's see.
Out of that, there were 3 doctors who wanted to operate on me. But this one doctor took care of me, and I didn't get no operation.
Okay.
And I also found out there's blood work for the thyroid, which nobody ever mentioned.
Joe, what's the question?
Yeah. My question is, I'd like to know about my thyroid. What does he think of the medicine I'm taking?
Okay, Joe, so I'd like you to listen to that, and we're going to have the doctor. You want to just talk a little bit about on the hypothyroidism?
Yes, so hypothyroidism is basically your thyroid not functioning as well as it should be. And thyroid has several functions. It can regulate your body temperature. It regulates your metabolism to a certain extent. And so from what I understand, you're saying that you're on Synthroid. Is that correct?
I went on that. It helped me out quite a bit.
He's on Synthroid, okay. Correct.
And your thyroid has not been taken out?
Yeah, no. 3 years ago, 3 doctors wanted to operate on me. I decided I had no pain, and said I'm going to make it other. Goes to show you, when you got to go for an operation, no emergency, make sure you go for other opinions.
Joe, that's the best thing you did is go for other opinions.
Exactly.
You know, and doctor, I want to tell you something. You make a great image in this program, and I read your interesting articles in the top of it all the time, that fine Catholic newspaper. And I like the position you're in tonight better than you were before. I want to say again, all good things in the future and beyond, and God bless you, and continue the good work.
Thanks, Joe. Thanks a lot. You want to just finish it? So.
Yeah. So Synthroid is the medication for hyperactive thyroid, and you're on the right medication. To see if you're if you don't have any symptoms, then you're probably at the right dosage of this medication. I recommend that you visit your hormone doctor, your endocrinologist, every 2-3 months to check your thyroid levels, as you had mentioned before, blood tests to make sure that he's giving you adequate extra thyroid hormone for functioning.
Thanks, Joe, and keep listening to the show. Thanks a lot. And before we move on, I got to remind the audience about the quiz. I had an experience today. I was in Image. It's a beauty parlor that my wife frequents. And Maya, Zoya, and Rose come to me and say, why does everybody like the plaque? Now, we give out a plaque. There's a prize that if you get the quiz right, and there are very few of them given out, maybe fewer than 40 in the history of the world, these plaques. And they couldn't understand the allure of these plaques. But anybody who's out there has gotten it. What do you hear about these plaques?
I mean, people just want more and more plaques.
Right. They
keep trying to win.
The bedroom, they got to move out. There's all over the walls, they're putting plaques, whoever wins the quiz. So I'm going to I thought it's a good lead-in into the quiz, a good segue.
You're absolutely right. I would love to remind the viewers of the quiz questions. You should call in and try to answer. Our first question, can you name 2 of the 5 hurricane names that were retired in 2005? 2 out of 5 is all we're asking for. And the second question is, who did USCCB assign as the patrons for November 2012 and for November 2013 in this year of faith? The number to call is 718-499-6101. Tonight's topics are cardiology and internal medicine.
Now, Patrick, I'll let you call back. If you want to call back for this, because Patrick's won several. Do you have any inkling, don't say it over the air, but do you have an inkling of the hurricanes? No. Which ones might have been required? Think back to 2005, any famous hurricanes that occurred that year. Okay, so let's move on with our calls.
Absolutely. I have to remind them the email address, which I checked through the whole show, is askthedoctor@netny.net. Now, we have Laurice on line 3. She is from Queens Village. She's been very patiently waiting.
Laurice.
Yes.
Laurice, how are you?
Hello. Hello.
Laurice, that's a beautiful name.
Yes, I'm doing great. How are you? Thank you so much.
Laurice, can I ask you if you could turn down the TV?
Surely, yes.
Okay.
Hold on.
You wonder, like, how many years it's going to take. Hi, Laurice.
Hi there. How are you?
Very good, very good. See, I give her the 7-second delay twice. That's all. So how are you feeling tonight?
Well, I'd like to know, I've been having hypertension for many years, and I'd like to know what causes it to be so unstable. I can go to bed at night with a blood pressure of 100/70, and I wake up in the morning and it's like 140/80.
What do you do at night during this time?
I'm sorry?
Oh, nothing. So the question is, what causes this erratic blood pressure? Dr. Mamkin, why is it so volatile?
Yes, even though I'm on medication.
Hypertension is a systemic disease. It really affects all organs, so it's extremely important to treat it very aggressively. Now, we have multiple treatments for addressing the hypertension problem. The most important one is the diet, okay? Laurice, you want to make sure you stay in low-salt diet, okay? Because salt, what it does, it holds on to water, and water increases the blood pressure, okay? That's number one. Number two, you want to make sure you take your medications at the same time. What I've come to notice in my practice is that quite frequently, patients check their blood pressure, and based on their blood pressure, they self-medicate themselves with different dosages of medications. And that's absolutely inappropriate, Laurice. What you should do, you should continue taking the same dose of medication as prescribed, once a day, twice a day, or 3 times a day, as prescribed by a doctor, okay? And that's going to prevent blood pressure raising, okay? That's very important.
And I want to ask, if the number keeps changing, what is the number that you should shoot for? What is the number you want your blood pressure below?
So it's not an easy question to answer. Laurice, it really depends on your medical problems, whether you have heart disease, diabetes. Different diseases require blood pressure to be at different levels. So it really depends on your past medical history, Laurice.
And one second, I want to check one more. If somebody comes in, has high blood pressure, first time you're seeing, what medication, after you've established it really is high blood pressure, what's a good medication to start with?
Well, like Dr. Mamkin said, lifestyle modification plays a big role in managing your high blood pressure. And low-salt diet, exercise, daily exercise, low-stress environment.
So I don't hear pills in here first.
No pills at first. You try to control it yourself. You maybe take yourself away from a stressful environment, low-salt diet, daily exercise. Weight loss is a very big one. If after all this lifestyle modification, you see that your blood pressure is still not at target, then we usually start you with a diuretic, a thiazide diuretic. They're usually, we call them water pills, and they make you urinate that extra water that Dr. Mamkin told you about, that spoke about earlier. So those are our first medications.
Laurice, so we're going to have to move on. You want to take a shot at the quiz?
Oh, thank you so much.
I'll take that as a no. I don't know. What was the?
I was thinking of hurricanes.
Okay.
Isabel, no.
Isabel, wait, you got a name
thank
too.
you so much. Have a blessed evening. Okay. Bye.
She's off the air?
We didn't want the flag.
We give her that noise anyway. That's what she gets.
She's
okay,
very
bye,
nice,
Louise.
though.
Take care, Louise.
You know, Dr. Garner, we have an email.
Oh, an email?
Yes,
Where?
it's from Frank, and he says, my mother was diagnosed many years ago with mitral valve prolapse.
Okay, mitral valve prolapse.
Ah, mitral valve prolapse.
No, but that's the way they say it in Kentucky.
That's awesome. She occasionally gets a chest pain here and there, but recently it has been more frequently. Her internist gave her a cardiogram and is sending her for an echocardiogram and wants her to see a heart doctor for a stress test. What is mitral valve prolapse?
So what is this mitral?
And how's it treated?
So
what is this?
Mitral valve prolapse, in fact, I'm going to show in this model of the heart. We all have 4 valves, and mitral valve is one of the 4 valves. Now, prolapse is a term that describes bowing or
Balloons.
ballooning,
Yeah.
exactly, ballooning of the valve. Okay, so I'm going to open this heart right here, okay, and you could see these white structures. These are valves, and mitral valve, in fact, is right here. So mitral valve prolapse is the ballooning or inappropriate closure of the valve, and quite frequently this leads to leakage of blood flow in a wrong direction. Now, typically, it does not cause chest pain, but electrocardiogram and echocardiogram are absolutely necessary for diagnosis of mitral valve prolapse. Mitral valve prolapse may be associated with arrhythmias as well and may present as palpitations. And therefore, we checked electrocardiogram to make sure the rhythm is normal. Does this answer your question, Frank?
We're not going to hear from Frank
Oh,
because he's
okay.
in the email, but we're going to, I think it answered his question. And it was a good
Great.
demonstration that the audience at home could see because it's talked about frequently, this mitral valve prolapse. And thank you very much for bringing that.
Sure.
Appreciate
And I believe it's very common among young women. It's one of
Yes,
the more common.
it's actually prevalent in young women, yes.
And back in my day, and I don't know if they still call it slick chick syndrome. Have you heard that? That was
I suspect that's before my time.
Yeah, he's not that much younger. Don't worry. Okay. But it used to be called slick chick because there used to be these thin, young females, and they used to have these psychiatric, almost, not quite psychotic, but they were a little bit flighty, right?
I haven't heard of that term.
Okay. Next time we're getting older guests. All right, that's it. We're going to take a short break. Now, tonight's number is 718-499-6101, as always, where our topics are cardiology and internal medicine. And don't forget the quiz. Can you name 2 of the 5 hurricanes named that were retired in 2005? And the second one is who did the USCCB assign as the patrons for November 2012 and for November 2013 in this year of faith? We'll be right back. Welcome back to Ask the Doctor, where our topics are cardiology, internal medicine, where we have Dr. Sabia Friedrich and Dr. Igor Mamkin. You can call us at 718-499-6101 or email us. And getting so many calls on our listeners, I know even though it's election night, they refuse to watch the returns. Just to give you the latest information I have as of this time is 87 to 78 Romney is ahead. Of course, early in the returns, but at least for those who want to know at home, that's what's going on. All right? So who do we have next?
Well, we have Harriet and on line 4, and she's from Brooklyn.
Harriet's from Brooklyn. Hi, Harriet.
Hi, how are you?
There it is. Hi, Harriet, you got to turn down the TV.
Okay.
Let me make an announcement. Can you make an announcement, Kirsten, about the TV?
Yes, for
Yeah,
everyone
I
calling
just did.
in, including you, Harriet, just make sure to turn down your TV
Okay,
before giving us a call, okay?
Down.
All right, now that
Thank
you've been
you.
reprimanded, we've changed the whole tone of the show. What can we do for you?
Okay, I have a question, and I want to know what you all think of.
She's on.
Oh, there's a delay. I mean, I want to hear you talking. I have to lower this. One second. I want to know what all the doctors think of mothers that have children that do not want to give any inoculations to any of their children.
Okay, you want to lower that, and why don't you listen on the? Can you listen on the phone?
Well, yeah.
Okay, hang on. We're going to get an opinion. Dr. Mankin, why don't you start? What do you think about this?
I think it's a little bit off my area of expertise. No, Dr. Friedrich, what do you think?
No, we're going to give you an answer. Wait, because I think it's disgusting. So I want to talk about it. But I want Dr. Sabia to say a word.
This is a very common question. Unfortunately, I don't deal with children. I deal with adults, and I am often, asked questions about the flu vaccines. With the children, it's very delicate, isn't it? Because there have been some reportable cases, but mostly, it's vaccine protects you from these viral illnesses, these severe bacterial diseases, which can actually cost the life of a child.
So you know what I'm asking?
Yeah, but I want to just say that the parents who don't give it, I think there's something wrong with them where they haven't read all the information. Because
okay, well, my daughter is a very big reader on books, and she has 4 children. One is 5, one is 3, and one was just born. She doesn't want to give any.
But Harriet, there's no sense, there's no literature to back that up. The person who first brought this up in the English journal called The Lancet lied.
And that's exactly what exactly.
I knew you'd find one person you agreed with.
I had a ride in a doctor's car last night, and I asked him, and he told me the man that said it, he lied. He made it up, and he's serving time in jail.
So now, if the parents want to listen to that, or want to listen to a doctor like Dr. Friedrich,
and I'm scared, and I don't know what to tell her.
You tell her that she's harming her children, and that she's doing something that makes no medical sense. That's what you should tell her.
Well, she doesn't listen to me. She says, "Ma, I can't talk to you." She lives in L.A.
Well, why don't you send her a clip of the show?
She won't listen. She doesn't have a television.
How about a computer? Because with streaming, you could go to netny.net, anywhere in the world, and you can see the show.
She won't do it. She read up on it, and she thinks it causes autism.
Well, and we know it doesn't.
Because we have, in my whole family, I have like 100 people in my family, and my whole life, no one ever got sick from any inoculations. She had it. My son had it. The only one
listen, it makes no sense, but now she can even get the shots without the mercury, which is what was said to be causing all these things.
I want to scare her. I have to put a scare into her.
Will you call us back and let us know what happened?
I don't know what to do. She lives in California. Whenever I mention it to her, she says, "Ma, I gotta go."
Well, I would send her a clip of the show.
Send her a clip of the show?
Yeah. Next week she can watch the rerun on the computer at 9 o'clock on next Tuesday, okay? At
on this station?
Yeah, on netny.net.
Okay. I hope she listens because I don't know what I would do to her.
No, the 7-second delay might be very effective because then you'll see. Don't do it. Don't do it.
How do you listen to? How do you not listen to a doctor?
I don't know, Harry. You brought her up, so.
Yeah.
What are you gonna do?
Well, I don't know. I have to talk to her and tell her to watch and listen to this.
Be well.
Okay. Thank you very much. Your show is fantastic.
Thank you very much, Harry.
Okay.
Take care. Who's next on the line?
So on line 1, we have Marta.
I want to ask something about my daughter.
Okay.
My daughter had a great disease when she started 20 years. Now she has 31 years, and she go to the endocrinologist. I don't know what's the name.
Okay, that's good. No, you had a baby.
My English no is good. Okay. The problem with my daughter is every time she's very hyper, she's gain weight every time.
Gaining weight? Okay, so she's scared to have a baby. You know what I need to do? Because I don't want to give you the wrong information. I can't understand everything that's coming off. Could you do me a favor and write it down and send us an email? And this way I can review the email and give you a good answer.
Okay. Okay.
Where are you calling us from, Martha?
Okay.
Okay.
To Brooklyn, New York.
Oh, Brooklyn. Very good. Okay, so if you send that email to netny.net/askthedoctor, I promise you we're going to answer it. We'll give it an answer on the air next week.
All right, perfect.
Very good.
So on line 2, thank you, Marta.
That's a nice
name,
Marta.
All right, we have Jane on line 2, and she's from Middle Village.
Hi, Jane. How are you?
Okay, how are you?
Okay, good. What's going on in Middle?
I want to tell you, You have a great sense of humor.
Oh, thank you. Did you have that problem with your children with the shots, giving them vaccines?
Oh, no, 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 no.
I mean, you want to protect the child, as Dr. Friedrich was saying. I mean, all these horrible viruses that we can protect now.
Of course.
So, what do you like about you like the new format of the show?
Yes, I do.
Good. You like Kirsty?
Yes, she's very nice.
Very good, very good. So,
congratulations that you got married.
Thank you so much. It's so nice of you.
Many years of happiness.
Thank you.
Thank you very much. You want to take a stab at the quiz?
Okay, I think it's Hurricane Katrina and Gustav.
Katrina and Gustav?
Gustav.
Gustav.
Oh, Gustav. Is it Katrina and Gustav? Oh, I got to give you a hint. You were half right, half right. But
Katrina is the right one, right?
Half right. That's all I'm going to say. Can we help
I wanted
you?
to ask you a question.
Sure.
For the cardiologist, in 2007, I was diagnosed with congestive heart failure.
And what's the question?
I want to know, does that go away, or does it stay with you, or what?
Dr. Mamkin.
Sure. So congestive heart failure is a very broad definition, broad word for medical condition. Sometimes it goes away, sometimes it stays the same, and sometimes it gets worse, okay? It really depends on what's causing the heart failure, what's causing congestive heart failure. And it also depends on what kind of medications or therapy you're on. If you're on a good medical therapy, these medications may strengthen your heart, and your function of the heart will come back, okay? So it's very important to take care of your heart and take all the medications prescribed to you by a doctor.
I hope that helps you.
Because he said the left ventricle, the muscle is very tight.
Sure. Well, once again, let me just show you what we're talking about.
Can we get a
right
picture
here.
of that heart over here, please? I just wanted to see.
So the left ventricle is this structure right here, okay? And sometimes it gets weak. It doesn't pump as well. And this is what we refer to congestive heart failure, okay? That's one of the congestive heart failures. This may be caused by either a heart attack or other medical conditions such as poorly controlled hypertension, virus, and so forth. So it really depends on what caused you having a congestive heart failure. So we need to do more testing and find out what's going on. And then based on that...
What causes heart failure?
I'm sorry,
what causes the heart failure?
Well, as I said, there are so many medical problems that can potentially cause your left ventricle to get weak. This may be an infection, very high, poorly controlled blood pressure. A heart attack can cause, or most commonly causes heart failure. So there's a whole bunch of things that can cause heart failure.
We're going to move ahead. I think it was a great answer. And thank you for the call. I hope you're doing well out there.
You too.
Be well.
Stay well. Bye.
Okay, that was interesting. There's a big portion, I'm sure, of the population you would see, too.
Yeah, absolutely. And I've only seen once a Chagas disease, which is the particular parasitic disease that causes it. But as Dr. Mamkin said, most of them are due to heart attacks and poorly controlled blood pressures and other medical diseases.
But you go to the doctor, he's going to take care of it so you have a good chance to live a normal life.
Absolutely. And you need to be followed regularly by either your internist or your cardiologist, and who can titrate your medication properly and follow the instructions.
Thanks. Who do we have next?
Well, we have an email.
Oh, an email.
And this is coming from India.
Hang on the phone. From India.
Isn't that amazing?
India. Amazing. We're really all over the world.
You're
it's
international.
amazing.
Okay. So, hi doctors. I'm writing about a newborn baby. But the day after her birth, she started to have fits of epilepsy. Her parents consulted the best neurologist doctor in India. They admitted her for 2 to 3 weeks and did tests like MRIs, CAT scans, and other tests that took blood from the spinal cord and brain tests as well, they said. Finally, they've given the baby some medicines, and the child's been discharged from the hospital, but after reaching home, the baby's in the same critical condition. The fits are coming regularly, every day, many times a day, and they need your advice. And this is Kuldip Singh. And he says, thank you.
And recently I was handed these. They also emailed or faxed these, emailed, I guess, the lab results. and we were taking a look at it before, and these pediatric seizures are very tricky sometimes, because sometimes it's something the child's going to outgrow. We know that he had an MRI, so there's no structural abnormality, there's no tumors in the brain or malformations, or, so there's none of that. So we're hopeful the baby can grow out of this. These are often difficult to identify. Do you have any?
Yeah, I mean, febrile seizures is one of the common presentations that children have with these recurrent epileptic episodes.
Right, so the child's a little bit older, may have that. If this is a neonate, in other words, just born within the last 3 months, 4 months.
Oh yes, neonates, it's hard to say what's triggering this, because as we saw, the baby doesn't have any structural diseases.
Infection can cause seizures.
But they did all the blood tests, and I think
I don't think there's any benefit to doing any more of these tests. We've done all the tests. They've probably tested out the spinal fluid for any kind of infection.
Yeah.
I think that a lot of it's going to be to suppress the seizures, to treat the seizures, and give the baby a chance to grow out of it. So we think he's on the right track, and if you can give us any more information, we'll be happy to run this by some of the doctors that we know that deal with this. So just send us some more information. What was his name?
Singh, I think something Singh.
Singh is like a common name. I went to the racetrack in India.
Kuldip Singh.
Kuldip Singh. I went to India to the racetrack to bet on it, and the jockeys, 12 jockeys, 12 guys named Singh. I'm going, come on, Singh, and everybody's looking. Yeah, is that a common name?
Yes, it is. It is a very common
name. Singh, yeah.
That's nice.
But anyway, my luck was no better than at Aqueduct. Some things transcend all the continents, so.
You ready for another
I'm
caller?
ready. We're all ready.
Okay, line 4, Helen from Bayside.
Hi, Helen.
Yes, hi, Dr. Garner.
How are you doing out there?
I'm fine, thanks. How are you?
Did you get hit hard with the hurricane?
No, I was lucky.
Yeah.
We didn't lose no power, no cable, no damage.
Beautiful, beautiful. I'm glad you were lucky.
Yes, thank you.
You want to take a stab at the quiz before we go?
Well, I know I'm going to not have the answer right, but I want to say Katrina and Anna.
Could it be Katrina and Anna? Well, I'm going to tell you that if... Oh, there it is. You're half right. I can tell you half right.
Okay.
Okay, what can we do for you?
Okay. All my life, whenever I got cold, my fingers would turn white, numb, and purple, reddish. And a few years now, I was diagnosed with Raynaud's.
Yes.
No one in my family has it. Why did I get it? And is it dangerous?
Okay, and we're going to get a 1-minute answer on this regarding Raynaud's disease. Is it dangerous? What is it?
Raynaud's is a type of a vascular disease. I'm sorry to hear that you're suffering from this, but it can be spontaneous. It doesn't have to be hereditary, and it can be associated with other diseases, other rheumatologic diseases. What I would do if I were you is go see a specialist, a rheumatology specialist, who can do further some molecular and genetic blood tests for you to see if your syndrome, Raynaud, is associated with these other diseases.
And what's her prognosis?
It's actually quite benign. If it's just Raynaud's,
So it's good news that the prognosis is good. And there is association with some rheumatologic diseases, as the doctor said, but it's something you can avoid. You can avoid the cold. There's ways to avoid this disease, the symptoms. Okay?
When I go to the supermarket, it's so cold there. I wear gloves, but I still get my fingers all white and numb.
Well, try and wear warmer gloves.
It's nothing dangerous, though.
No.
No.
No. Okay. Thank you.
Thanks. Have a good night. We're going to move to a rapid fire segment. We're going to answer the question 1, 2, 1, 2. We'll go like that. So who's the first one?
All right. Line 1, Elmer from Manhattan.
Okay, Elmer, how are you? Elmer. Elmer.
Okay, we'll go to...
hello.
Oh.
There you are, Elmer. How are you?
Very well, doctor.
Did you go to check out the elections or what?
Oh, beautiful. I waited an hour and a half to get to vote.
I couldn't believe it. Anyway, this is the rapid fire segment, so I'm going to take the question and get your quick answer.
Right. I would like to ask Dr. Sabia Bridges, is she is an internal medicine. She knows anything about numbness of the hands, especially when you raise them up a little bit or when you're sleeping.
Okay, I get numbness of the hands when he raises it up a little bit, or when he sleeps, his hands feel like he's going to sleep.
Okay, that depends on, if it's always the same hand, if you're sleeping in a certain position, are you compressing one of your nerves? And when you raise the hand, it may just be you don't have very good peripheral blood flow. It also depends if you have any associated medical diseases, such as diabetes. So I'm not quite sure what your case is, but
Elmer, where are you calling us from?
I'm calling from Manhattan.
Which part?
Midtown Manhattan.
Midtown. Do you have any other medical conditions?
I went to a diabetes doctor, but I don't have no diabetes, no high blood pressure. I got arthritis on my knees.
Okay.
Okay, so those are all good news that you don't have the chronic diseases. What you may want to do is see which fingers they are. Are they always the same hand? Are they always the same fingers? And if you have, with the numbness, if you have tingling or something else going on, then you may want to go see a neurologist to do some further testing.
Elmer, we may be able to get an x-ray that'll help to show if this is coming from the neck. You never know where this is coming from.
Yeah.
So,
right. Yeah.
Especially if you're sleeping on that arm.
So definitely go to see a neurologist and get that x-ray, okay?
Usually happens in the morning when I'm praying the rosary. It gets numb, so I have to drop my right hand,
Elmer, follow what the doctor said. Go to the neurologist.
I will. Thank you.
Give us a call back. Let us know, okay?
I will, by all means.
Thanks, Elmer. Who's next? And the rapid fire is turning into sort of rapid fire.
So line 2, we have Robert from Flushing.
Hi, Robert. How are you?
Hello.
Robert, how are you? Good night.
Hey, I'm fine. I have a question. I also would like to take a stab at the quiz.
Very good.
My question is that I was on Coumadin for a number of years, but it didn't work out too well because very often I would wind up with no Coumadin until my next appointment. After consulting with my doctor, we switched to Pradaxa. The problem with Pradaxa, the way I understand it, is there's no antidote.
Right, so we need the question because I only got such a little amount of time. What's the question?
The question is, which do you prefer? There's no antidote for Pradaxa. For Coumadin, it's vitamin K. Am I okay staying on Pradaxa?
30 seconds.
Right. So we have various ways of treating treating atrial fibrillation or whatever you're taking Coumadin for. Coumadin is the gold standard. Pradaxa and Xarelto are the newer agents. You're absolutely right that there's no antidote, but if your risk for bleeding is low, there's no need for antidote. We just give you a trial of Pradaxa or Xarelto based on your need, and we see how you feel with it.
Sorry, we got to move on. You have a quick answer to the quiz?
Yes, I think it was the patient for November of 2012. I think it was St. Francis Xavier Cabrini.
Okay.
And for 2013, I'm pretty sure it was the Venerable Fulton J. Sheen.
Let's see if that's correct. Okay, just under the wire. I mean, this is amazing. The patient's just amazing guess.
Okay, good. Now, as far as the hurricanes, I can name all
Oh, no,
five
we're
of
going to
them.
do that next week, so you call back. A plaque is going to be speeding its way to you.
Well, thank you so much.
Send us your information.
Be well. I'm getting all kinds of fingers here from the guy, to go like that. So let's try and, that's it for this episode of Ask the Doctor.
Okay.
I'd like to thank doctors I always go to Dr. Kirsten Elizabeth, but Kirsten Elizabeth, Dr. Sabia Friedrich, Dr. Igor Mamkin for coming in. We hope we're able to help you, and it's good to remember, right? Get second and third opinions, just like we talked about tonight. Always be proactive about your health. Don't be afraid to speak to your doctors about your problems. And again, if you want to get another opinion, ask the doctor to refer you to another doctor for a second opinion. He should not object to that. Visit our website at netny.net/askthedoctor. And here you can read the tablet column. You can watch past episodes of the show and read blogs. And send us your emails there so we'll answer them on future shows. Now, for next week, we're going to discuss dental and oral surgery and internal medicine. Also, keep our families and friends and neighbors in mind who were affected by the Superstorm Sandy. Have a great week, and see you in the tablet.